Welcome to ThinkTech on OC16, Hawaii's weekly newscast on things that matter to tech and to Hawaii. I'm Donna Blanchard.
And I'm Noina Au.
In our show this time, we'll cover the Grassroot Institute August Calabash on saving our state hospitals.
We'll listen to an important panel discussion dealing with solutions to a very difficult public health issue in Hawaii.
The backdrop of the discussion is that after years of financial insolvency, the Hawaii Health Systems Corporation, which operates Hawaii state hospitals, is plagued with layoffs and closures. Medical services for thousands of Hawaii residents, many of them in or near poverty, are now threatened.
Governor Ige recently signed a bill allowing successful private hospital operators to bid for the hospital management contracts on Maui. This program brought together a panel of experts, including representatives of private hospital operators, Hawaii Pacific Health, and Kaiser Permanente, to address the possibilities and challenges of taking over and reorganizing the state hospital system, a formidable task.
The panel included a number of experts in public health. Dr. Josh Green of the Hawaii State Senate and long-term member of the Senate Health Committee, Maui Mayor Alan Arakawa, Dr. Nicole Apoliona of Kula Hospital, Dr. Gerard Livaudais of Hawaii Pacific Health, and Dr. David Ulin of Kaiser Permanente.
The program was moderated by Keli'i Akina, president of Grassroot Institute, and host of our weekly Ahana Kako live stream talk show on the ThinkTech Hawaii broadcast series.
On behalf of the Grassroot Institute, I welcome you to our panel discussion today, which is co-sponsored by ThinkTech Hawaii. Thank you, ThinkTech, for broadcasting today's presentation and recording it. We'll make available the program to everybody. Today's panel is entitled Saving Our State Hospitals, Maui's New Public-Private Partnerships. And we've got a wonderful team of panelists today, experts in their field, who are going to be talking about this vital topic. Why is this so very important and so very urgent? I think there are two major reasons, and the panelists may suggest some others. First of all, from a human point of view, our state hospital system exists to meet the needs of human beings. Many of them are of an income level that absolutely require assistance in the form of a state hospital system, and that system has been challenged. It affects other things in our islands. For example, the closure of hospital clinics and the reduction of staff have impacted psychiatric treatment for the poor, which results in increasing the numbers of the homeless. So many things are highly connected to whether or not we're able to provide health services. As you know, the Grassroot Institute and many, many others were active over the last 3 years in helping to research and to testify before government leaders about the importance of evolving our state hospital system. And so a word of praise goes to our state legislature, as well as our governor, for giving us a law now that allows this to start going forward, a public-private partnership on the island of Maui. And the other islands are actually looking to that as a potential model. This is very important for many reasons. For one, it ensures services. For another, it helps to evolve an appropriate role relationship between government and the private sector. And what is very exciting is that there are competitors now. Milton Friedman would love the free market competition taking place. May the best man win, and a couple of competitors are represented on the panel today. The public wins when there's free market competition, and so we give kudos to our government. First, immediately to my left is Senator Josh Green from District 3 on the Big Island, but he's also a medical doctor. He's an emergency room physician on the Big Island. He continues to provide a leadership role statewide as Hawaii's voice for healthcare. He's the majority floor leader and the majority whip, and so please welcome him to our panel today at the Grassroot Institute. Welcome, Senator Green. Next to Senator Green is Mayor Alan Arakawa, who really needs no introduction, but I'll give him one anyway. He was born in Wailuku, graduated from Maui High, attended the University of Hawaii as a business major, and now he runs Maui. He's been working very hard to save the Maui hospital system. Mayor Arakawa, welcome to Oahu. Aloha. We have next to the mayor, Dr. Nicole Apoliona. of Kula Hospital Maui, where she is the medical director of the hospital and the clinic. She's seen major challenges in the system from the inside, and one of the things I'll note is that Kula Hospital is largely a long-term care hospital and a rural hospital, but part of a broader system. So she's an expert in knowing how those dynamics of being small and being big work together. Please welcome Dr. Nicole Apoliona. Next to Dr. Apoliona is Dr. Gerard Livaudais. He's with Hawaii Pacific Health as the Executive Director of Hawaii Health Partners. That's a diverse group of physicians from Hawaii Pacific Health, and they work to bring increased efficiency to healthcare in Hawaii. He was educated at the Tulane School of Medicine. We welcome you, Dr. Livaudais. And finally, Dr. David Ulin from Kaiser Permanente. Dr. Ulin was born and raised in Chattanooga, Tennessee. He is the physician in charge of Maui clinics, and he pursued a career in pediatrics. Please welcome Dr. Ulin. Our format is very simple, and it engages all of you, in fact. We'd like as many of you as possible to ask the questions that are on your hearts and minds. Take advantage of the experts before us. We have the great opportunity, thanks to this partnership between the Grassroot Institute and ThinkTech Hawaii, to dig deeply into the issues today. And you know that they are very, very timely. I'd like to just encourage each of the panelists to share their mana'o at the beginning, and I'll start with Senator Josh Green. Senator Josh Green, you understand the context of what's going on with the public-private partnership on Maui. Can you tell us a bit about why and how our hospitals are struggling and why we need to find new solutions?
There are several reasons. One is that the payer mix for our public hospitals is 70-30, which is to say 70% of all of our patients that go to the healthcare safety net hospitals, 70% are insured by Medicaid or Medicare, which both pay less than the cost of care itself to be delivered. And then also having the system that we do for our public hospitals with the workforce, it's, I would say, an imperfect match. So though I'm very close to all of the workers, all of the employees at each of our hospitals, in some cases having a civil service system for a 24/7 operation is very challenging for our teams that administer the hospitals, and it does come with extra costs. So those are the two main factors which make it very difficult.
Mayor Arakawa, perhaps you more than anyone else understands the relationship between the islands of Maui County and the rest of the state. Now we see something quite progressive taking place with the public-private partnership of the hospital. How does what's going on in Maui with the hospital and even more generally relate to the rest of the state?
All of our major facilities, all of our hospital facilities have been underfunded. And because of the underfunding, the advancements in technology that needed to take place did not occur.
Now next we have Dr. Apoliona, and you have been serving in Kula Hospital within the context of a broader system on Maui, and I really want to ask you more about the overall system of the hospitals on Maui. What kind of condition are they in such that they require a public-private partnership?
We were completely dependent on one acute care hospital on Maui, and if that hospital failed, our community would fail. So my involvement in the legislation this year and my advocacy was both as a physician who cares for patients and also works on the administrative side of our hospital system. I see the difficulties that are inherent in being in the state system, the checks and balances that are required when you're spending taxpayers' money also make it very difficult to be efficient and get work done. On the one side, and the other side, as a resident of Maui and a mother and a daughter, it became a mission to me that we needed to improve the healthcare of Maui and make sure our hospital didn't fail.
Now we have representatives of both Hawaii Pacific Health and Kaiser here at the table as well, and I'd like to ask you each the same question, really. In a general, Dr. Livaudais, what does the private sector, what does business, a private hospital system, have to offer to a state hospital?
Well, first, I think it's a wonderful opportunity to see healthcare improved in this partnership. And I think that there are no really bad options here between the two suitors for the business. But if pressed, and that was your question really, is what can Hawaii Pacific Health bring to this partnership? And it's a complex question, it's a complex subject, and I hope that we'll have a chance to have some good conversation and probe the depth of it. But when you ask a big question like that, sometimes it's helpful to be a little simple. And so in my mind, the simple answer for that question is that Hawaii Pacific Health brings a completely local, a completely open, and a very completely experienced solution to this opportunity.
No matter which organization takes over this hospital, we're blessed on Maui. We've got two organizations that are very patient-centered and very much committed to the care on Maui. So I think it's been a real testament to the state legislature that they put us in a position that that's where we're going to end up with as a solution. So we're very happy to start with that. I think as a public-private partnership, it's such an interesting idea that you're going to get the financial strength of the state with the flexibility of one of these local organizations with skills in private practice.
After initial presentations by the panelists, the panel took questions and comments from members of the audience.
After the program, we had a chance to get some feedback from the people in the room.
The significance of what's going on in Maui was brought home to me today. When we were fighting for it during the legislative session, we felt like we were our own, we felt like we were fighting against the force of the state of Honolulu. And it was very gratifying for me today to see that there's a broad interest across the state.
There's one thing I learned is that the people who are working in the system are very anxious to make changes and to implement changes that they see are needed. And I think when we have informational meetings like this, we get to know better what is happening and we can tell our elected representatives too.
The public wants care. The public wants it to be affordable. The public wants it when they need it. The public wants it to be local and to be the highest quality possible. To bring the issue very close to them is difficult because it's extraordinarily complex. You just saw 5 people who live this, who have trouble talking about it and understanding all the barriers are to health. So the public needs to hear this. They need to be involved in the conversation, but it's difficult. That's a long way around to say member councils really work. So family and patient-centered care, where you spend time with your families, talk to them, ask their commitment for all the issues, is extraordinarily important. At our clinic on Maui for Kaiser, we have a member council. We meet once a month. We go over everything. We ask their input. Members sit in all our team meetings and all our healthcare teams. And they're extremely instrumental in giving us input into care. Oahu does the same thing in Kaiser, and I would think that no matter what, if Kaiser has the honor of taking Maui Memorial, there will be a member council. We're going to ask people what they want. One of the main goals of patient and family-centered care in the hospital is to remove visiting hours. And the first thing that has happened at MOA, the Kaiser facility, is there are no longer any visiting hours. It's open care. And that is something that our member council asked for on day one when they were established, and we have gone to that. And I think very rapidly on Maui, we would go to that also. At the present time, about somewhere between 5 and 10% of all of our appointments are made online because we allow patients to do everything online on Maui. Our doctors at this present time probably do 50% of their work either in the form of emails or telephone calls.
Well, I have to thank the Grassroots Institute. It provided an opportunity for many people to come in and ask questions intimately, which in my experience hasn't happened very often. So as an individual on Maui who's representing people who this will directly affect, this was an outstanding event.
It's nice to see that the people in Maui are stepping up to kind of guide their own destiny. I think that we have good partners that are investing in this bid for Maui Memorial, and I'm going to be comfortable whether it's Hawaii Pacific Health or Kaiser taking a leadership role on Maui. I just really want to see patients get comprehensive care, and something had to change, as we all know, because the economic model is just not working. Yeah, this is definitely a period of consolidation. It's what you're seeing across the country. Even some of the gigantic health insurers are merging. It's really because the healthcare margins have been challenged by the Affordable Care Act and by the fact that we reached kind of a threshold of tolerance for paying in our country for the budget. When we reached 18 or 19% of the GDP spent on healthcare, everyone decided that they didn't have a capacity to spend much more. So now everyone's consolidating, partnering, trying to find areas of savings and efficiencies, and that's why you're seeing these kind of things locally.
I really appreciate the opportunity that ThinkTech Hawaii and Grassroot Institute had today to co-sponsor a panel. The general focus was on the changes that are happening in the way we deliver hospital services as a state. And in specific, we talked a bit about the Maui situation. What's important is that things are changing in the state of Hawaii. After decades of government taking a particular role, we are at a time when we're re-examining the relationship between the government and the private sector, where we're asking questions such as, what is the government good at doing and what is the private sector good at doing? And when one party is better than the other, we move to that. That makes a lot of sense. And so that's why I'm so glad that today we had government leaders as well as industry leaders talk about a major change taking place in Hawaii's political and economic landscape.
The subject is not without delicacy and some contention. After all, this is a landscape decked with competing interests that may not agree on exactly what to do, including federal and state government officials, labor unions, health professionals, hospital organizations, and, of course, the public.
This was a great discussion of an important subject designed to help us understand the complexities of the state hospital system and the solutions that can deliver better care to the people of Hawaii, particularly in Maui.
This is a story that will affect many people in Hawaii and hopefully provide higher quality health care to many people desperately in need. But it's certainly not over. ThinkTech will follow the story going forward and let you know how things come out, one way or the other.
Kudos to the legislature and Governor Ige for opening the system up to the possibility of new management. Kudos to the private hospital operators willing to take a chance on the risks of managing hospitals that have been so troubled for so many years. And kudos to the Grassroot Institute and the panelists in this program for being willing to raise and discuss the issues at hand.
This is a story that will affect many people in Hawaii and hopefully provide higher quality health care to many people desperately in need. But it's certainly not over. ThinkTech will follow the story going forward and let you know how things come out, one way or the other.
And now, let's take a look at our ThinkTech calendar of events going forward.
ThinkTech broadcasts its talk shows live on the internet from noon to 5 p.m. on weekday afternoons, and then we broadcast our earlier shows all night long. If you missed a show or want to replay or share any show, they're all archived on demand on YouTube.
Visit thinktechhawaii.com for our weekly calendar and our live stream and YouTube links, or better yet, to sign on to our email list and get the daily docket of our upcoming shows.
ThinkTech has a great new studio at Pioneer Plaza. We invite you to come down and see our studio and be a part of our live audience. Contact jay@thinktechhawaii.com. Be a part of our civic engagement on ThinkTech.
Go ahead, give us a thumbs up on YouTube or send us a tweet at ThinkTechHI. We want to know what you're thinking and how you feel about current events and issues affecting Hawaii. We want you to stay in touch with us, and we want to stay in touch with you. Let's think together.
On Thursday, September 17th, ThinkTech will join with the Anthology Marketing Group to present a program called Hawaii, the State of Hospitality, Are We Reaching Our Limits? At the Anthology Theater in Bishop Square.
The program will cover the status and prospects of the hospitality industry in Hawaii and will feature business, government, and academic experts on tourism in Hawaii.
Join us and raise your awareness about the critical changes taking place in Hawaii. Be a part of the conversation and sign up to attend on thinktechhawaii.com.
And now, here's this week's ThinkTech commentary.
Aloha, I'm Richard Melendez, and this is The Thought Balloon on ThinkTech Hawaii. The Thought Balloon is where I share reviews and discuss topics related to comic books and graphic novels. Last time, I spoke a bit about new versions of familiar characters and also touched upon how myths evolve in their retellings across generations. Today, I take a look at a sort of melding of these two concepts. Now, thanks to Marvel's movies, everyone knows who Thor is. Tall, golden-haired hero with disarmingly good looks and Anthony Hopkins for a father. Of course, the character of Thor dates back far longer than Marvel's publishing history. He was a prominent character in Norse mythology, and it's from that mythology that a new comic series pulls from, albeit with a twist. The series is called Ragnarok. If you know your Norse mythology, Ragnarok is the name of the long-foretold twilight of the gods. Think of it as the Norse version of the biblical revelations. Everything comes to a head, evil triumphs, Asgard is left in ruins, and all the gods have fallen in battle. That is how the mythological tale of Ragnarok ends. But Ragnarok the comic picks up centuries after that final battle, where a withered, undead Thor awakens to find the world he once knew is now a wasteland. At first, he doesn't know what's become of the world, nor how he ended up where he is. He's got many questions, and he sets out to find those answers. Along the way, he encounters the current residents of this realm and is able to piece together what's happened over the last few hundred years. Meanwhile, there are forces conspiring against Thor, beings who tried to prevent his reawakening, and those who wish to bring him down. Now, Ragnarok feels a bit like a Clint Eastwood Western, or a Mad Max film even, in that we have a lone warrior traveling the Badlands, doing good along the way. And as you'd imagine, this has more than just passing touches of Conan the Barbarian, Lord of the Rings, and other fantasy stories that feature magic, monsters, and swordplay. Thor is familiar to many, and Marvel, along with many other publishers and film studios, have played with some interpretation of this character. But the version of Thor seen in Ragnarok is Thor after the apocalypse. Not the nuclear apocalypse we're used to seeing in pop culture, but rather it's the apocalypse that is brought down upon the gods. It's a novel and intriguing setup that pulls straight from the source material while touching upon other genres to give a fresh spin on the character and his setting. Ragnarok displays a wry sense of humor, conveyed mostly in the banter between Thor and the individuals he meets along his journey. It adds a measured bit of levity in an otherwise dark setting. However, while it is dark, the setting is also grand and epic. We're never left to forget that this is an otherworldly realm, and all of this is rendered beautifully by Walt Simonson, who handles both the writing and the art. His unique art style appropriately balances the drabness of a destroyed landscape while still capturing its epic scale. His art can also handle a simple conversation or choreograph an exciting sword fight. Simonson is an accomplished artist, but also very much a seasoned storyteller who knows how to compose his panels and pages to move the story forward or skillfully keep a moment suspended. Now, for example, there's one page in the 6th issue that consists only of 7 panels of Thor holding the remains of his dead wife. There's no text until that last panel. In lesser hands, this could have felt redundant or unnecessarily drawn out, but Simonson is a master at his craft and is able to lend the appropriate weight to this sad moment. The longtime comic readers may recognize Walt Simonson's name. Simonson has had a long career in comics, working on many of the major characters published by both Marvel and DC Comics. He's perhaps best known for his work on Marvel's version of Thor during the mid-'80s. Many of the concepts and characters he had in creating are still around today and have even found their way into the movies. So yes, Simonson is quite familiar with Thor, but again, this isn't Marvel's Thor, and this isn't a retelling of familiar myths. Ragnarok draws from the old to give us something entirely new and fresh. And though Walt Simonson has been working in comics since the 1970s, this comic proves that he's still got it. Ragnarok is Simonson at the top of his game. The 6th issue of Ragnarok was just released last week, so it won't be difficult to jump on board and get caught up. Thank you for watching The Thought Balloon on ThinkTech Hawaii. I am Richard Melendez. Until next time.
We'll be right back to wrap up this week's edition of ThinkTech. But first, we want to thank our underwriters.
Okay, Noe, that wraps up this week's edition of ThinkTech. Remember, you can watch ThinkTech on OC16 several times every week. Can't get enough of it, just like Duke Oishi does. For additional times, check out OC16.tv.
For lots more ThinkTech videos and for underwriting opportunities on ThinkTech on OC16, visit thinktechhawaii.com. Be a guest or volunteer, a producer or an intern, and help us reach and have an impact on Hawaii.
Thanks so much for being a part of our ThinkTech family and for supporting our open discussion of tech, energy, diversification, and globalism in Hawaii. You can watch this show throughout the week and tune in next Sunday evening for our next important weekly episode. I'm Donna Blanchard, and I'll see you on Center Stage, 2 to 3 p.m. this Wednesday.
I'm Noe Na'au. Aloha, everyone.